Welcome to Raaonline. Today's topic of discussion is femoral triangle. The competency of this topic is describe boundaries, floor, roof and contents of femoral triangle and describe anatomical basis of psoas abscess and femoral hernia. Let's see what is femoral triangle. Femoral triangle is a triangular depression which is seen in the front of upper one-third of the thigh just below the inguinal ligament. The other name of the femoral triangle is triangle of Scarpa. So, the base of the triangle is located above, that is by the inguinal ligament, and the apex of the triangle is directed below. Let's see the boundaries of femoral triangle. So, this is the area for the femoral triangle. The lateral boundary is by the medial border of the sartorius muscle. So, this is the sartorius muscle which runs from the anterior superior iliac spine to the tibia. Okay, so this is the sartorius. So, its medial border forms the lateral boundary of femoral triangle and the medial boundary is by the medial border of the adductor longus. So, adductor longus is a muscle of medial compartment. So, the medial boundary is by the medial border of adductor longus and the lateral boundary is by the medial border of sartorius. Then the base is formed by the inguinal ligament and the apex is formed by the meeting point of the sartorius muscle and the adductor longus muscle. So, this apex is continuous below with the adductor canal. Let's see the structures present in the roof. Just beneath the skin there is a superficial fascia, deep to that there is a deep fascia. Okay. In the superficial fascia we can see the superficial group of lymph nodes. So, these are the, this green colored thing are the lymph node. So, the superficial group of lymph nodes are arranged in the horizontal direction just below the inguinal ligament as well as just lateral to the femoral vein. So, these are the horizontal group of lymph nodes just parallel to the inguinal ligament and the vertical group of lymph nodes lateral to the femoral vein. Okay. So, in the superficial fascia there is a superficial group of lymph nodes. Then there is a femoral branch of genitofemoral nerve. Let's discuss this in the upcoming slides. Then the branches of ilioinguinal nerve. Here near the, more or less near the midline there is a ilioinguinal nerve and the superficial branches of femoral artery. So, already we know the superficial branches of the femoral artery are superficial external podental artery, superficial external podental artery and superficial circumflex iliac artery and superficial epigastric artery. So, these are the branches of femoral arteries. The femoral artery is deep to the femoral sheath. From there the branches pierces and comes out in the superficial region. Okay, once again I repeat, the femoral artery is within the femoral sheath. The superficial branches of the femoral artery are superficial external podental artery, superficial epigastric artery and superficial circumflex iliac artery. Other than this, the tributaries of femoral vein are superficial circumflex iliac vein, superficial, so this indicates the superficial circumflex iliac vein and superficial epigastric vein and superficial external podental vein. So, these are the some of the tributaries of great saphenous vein and we can see the terminal part of the great saphenous vein also, and in the deep fascia we can appreciate the saphenous opening and the saphenous opening is closed by the cribriform fascia. Okay, so these are the roof structures. In the roof we can appreciate a superficial group of lymph nodes, femoral branch of genitofemoral nerve and the ilioinguinal nerve and the superficial branches of femoral artery and the tributaries of great saphenous vein as well as the femoral vein and the upper part of the great saphenous vein. The deep fascia has saphenous opening which is closed by the cribriform fascia. Let us see the flow structures from lateral to medial. So, this is the lateral aspect and this is the medial aspect. So, the flow muscles are from lateral to medial: iliacus, psoas major. So, the star one is pectineus and most medially adductor longus. So, the floor of the triangle is mainly by the muscles. There are 4 muscles from lateral to medial: iliacus, psoas major, pectineus and adductor longus. Okay. So, these are the floor muscles. Let's see the section at the level of the femoral triangle. We can see the relations in this section feature. So, superficial to deep skin, deep to the skin there is a superficial fascia. In the superficial fascia, we have seen the important structures what are present in the superficial fascia. Deep to there is a fascia lata. Within the fascia lata, we can appreciate the cribriform fascia. This cribriform fascia which covers the which opening? Saphenous opening. Then these are the roof structures. And coming to the floor structures, flow from lateral to medial aspect. We can appreciate the iliacus muscle. Then there is a tendon of psoas major. Then the pectineus and adductor longus. So these are the floor structures. So in between the iliopsoas, that is between the iliacus and the tendon of the psoas major, we can appreciate the femoral nerve. So this is the iliacus and this is the tendon of psoas major. In between we can appreciate the femoral nerve. Deep to that there is a capsule of hip joint. Okay. So the structures present within the femoral triangle are especially the femoral vessels and the femoral nerve and one group of lymph node, that is the lymph node of Cloquet and a femoral branch of genitofemoral nerve.